Throughout the pandemic, we have encouraged you to send us any questions you may have about COVID-19 or the vaccine. Well, last night you all sent in several questions, so THV11's Jordan Howington collected them all, and now she's taking them to the experts to have them answered.
We took your questions to two experts. Dr. Ahmad Yusuf is CEO of Rock Medical Group, and Dr. Jessica Snowden is Chief of Pediatric Infectious Disease at Arkansas Children's. They're here to answer your questions. Dr. Yusuf answers this text to us. What is the difference between 2003 SARS and 2019 COVID?
But the difference between that one and this one is that this one spread so quickly and so rapidly and has not done what those did, which was that they stayed relatively local and kind of burnt themselves out because they didn't spread fast enough.
Another question, can someone with symptoms who test negative for the virus still get the COVID-19 vaccine?
There's actually some evidence that people who already had COVID, not only do they benefit from the vaccine, they actually get really great antibody levels and tolerate the vaccine really well. So absolutely, if you have a minor illness, but you know it's not COVID-19 and you don't need to be staying home and away from people, go ahead and go out and get your vaccine.
A viewer from Searcy was recently hospitalized with COVID. She says doctors still encourage her to get the vaccine. Her question is, why are they insisting I get the vaccine when I've had the virus and survived?
I think that's a great question. All this stuff is new to us. We're learning as we go. And so as the literature unfolds, we're going to learn more things. But at this time, if I'm worried about somebody who's high risk, I say use every protective measure you can. And you have antibodies from your vaccine, from your natural disease process. We have this extra tool that may protect you further.
Lastly, what is research saying about the effects of the vaccine on the heart of teenage boys?
COVID-19 infection itself can impact your heart enough that you actually end up in the ICU on lots of medicines for us to help your heart work better. And that's not something we see with the vaccine. That's something we see with the virus. So even though that side effect is out there, it's still much, much better to go ahead and get the vaccine.
Jordan Howington, THV 11 News.
All these answers will be on THV11.com if you want to share with friends and family. And remember, you can always text us your questions at 501-376-1111.